Hello everyone, Assalamu alaikum. We are going live, as I can see. Thank you so much for the Humanitarian Congress Berlin for this year, for organizing this important panel with our esteemed panelists. My name is Afrah Nasser. I am a Yemeni researcher. I work as the Yemen researcher with Human Rights Watch organization. I work in documenting human rights violations and IHL violations in Yemen. I'm based in Sweden, but we continue to do our work with the help of some of our panelists here. Actually, some of them are close partner, and I've collaborated with them. And I'm very, very glad to have Dr. Sami Al-Haj, a physicianist, a general physician based in Sana'a, very famous for his initiative, Awqifni, and a doctor, Stop Me, I Am a Doctor, giving voluntarily important advices for random civilians on the street in Sana'a. And he emerged during the COVID-19 pandemic in Yemen. And we will speak to him later about the situation in the health care facilities in Sana'a. We have also my friend Saddam Al-Adwar, based in Marib, one of the largest hosting areas in Yemen for IDPs. Saddam is the co-founder and executive of Musa'ala organization, documenting human rights violations and with a great focus on accountability issues. And they have produced some of the tremendously important reports about the situation for IDPs. We have also Majid Talib. Unfortunately, his colleague Wafa was supposed to be in this panel, but we're very, very glad that Majid Talib from the organization Doctors of the World, based in Sana'a. He has a great experience working in the humanitarian field in Yemen. And we're very glad that you made it, and we are keen to hear more about the situation and based on your experience in Yemen later on. But first, let me just say for our audience that there is international science section in the session sessions areas to the left side of the screen that you can also get access to. Also, there is an Arabic translation place. My colleagues will share the link and the code in the chat section. And lastly, please tweet with the hashtag HCBerlin if you have any thoughts and questions. And also feel free to send us questions in the chat box. And my colleagues in the Humanitarian Congress Berlin will help me in filtering some of the questions. So, okay, let's get into this important topic. I mean, I was getting some comments from friends preparing for this discussion. Did you prepare, Afrah? And I was like, what can you prepare for like such a tragic situation in Yemen? It's a crisis in a very multi layer, impacting all aspects of life. I want to start with Saddam because we want to get like first as a summary of the key elements of the conflict, the division, how the conflict really divided the situation on the ground. Who are the key players right now? And what's the international role also? Because we hear a lot about the arms sales from the US, the EU countries, and etc. Go ahead, Saddam.
Yeah, thank you so much, Afrah, for the introduction. Good morning and good afternoon, good evening to all people who are listening or watching us right now. I'm sure most of you are familiar with the context of the conflict or the war in Yemen. At least you have a general information, and talking about the context of the Yemen war in a few minutes is not that easy way, and even understanding the complexity of the war in Yemen is difficult for us as Yemenis. So I'm going to give you just like a snapshot or a facts about the Yemen war. Talking about the Yemen war is still going on. It begins in late 2014, mainly between two factions. The first one is Abdurrabbu Mansour Hadi led Yemeni government, and the second one is Houthis armed movement. So it started in 2014 when Houthis, supported by former president of Yemen, Ali Abdullah Saleh, they got control and they take control of Yemen capital, Sana'a, and forcing President Hadi to relocate himself and his government into Aden city. After that, Houthis started or proceed toward the country's second biggest city, that is Aden in the south of Yemen. So in response to Houthis' advances, a coalition of Arab states launched a military campaign or a military interventions in late March 2015 to defeat Houthis and also to restore Yemen's internationally recognized government to power. And since 2015 until now, the Saudi-led coalition is still supporting the Yemeni government in its battle to defeat Houthis. So talking about who's fighting whom, there are multiple key warring parties in Yemen's war. However, the conflict divided into two main categories, as I mentioned before. The Yemeni government led by President Hadi, and the second one is between Houthis, and Saleh also. Houthis and our former president Ali Abdullah Saleh, who were allies from 2014 until their alliance collapsed in December 2017, which left Saleh dead, and Houthis continue their fighting and their battle to get control of Yemen and other governorates. Along the Red Sea coast, there is a military offensive led by Tariq Saleh, a nephew of Ali Abdullah Saleh, who is supported and his forces backed by the United Arab Emirates, and they are also intent to fight Houthis, but they did not take their orders and commands from Yemeni government led by Hadi. At the east of Yemen, the Yemeni government, along tribes, fighters, also backed by the Saudi-led coalition, fighting in borders of Marib, along with Al-Jawf, Shabwa, and parts of Ta'az as well. And in the south of Yemen, there is a Southern Transitional Council, STC, which was formed in 2017 by different members, included governors of 5 southern governorates in Yemen, and they called and worked toward separation of southern Yemen from the rest of the nation. So the STC forces are backed by the United Arab Emirates, and they have armed group forces in many areas of the south. They are also not following orders or commands from the Yemeni government led by Hadi. These are the main parties to conflict in Yemen. And by talking about the international involvement in the Yemen war, we can say that Saudi and Arab Emirates, United Arab Emirates, are supporting the Yemeni government and also the STC in South Yemen. We have also the US, United States, along with other Western power countries, such as United Kingdom, France, Italy, who also supplied the Saudi-led coalition with weapons and also provide logistic support and intelligence as well. selling weapons as an arm also to the Saudi-led coalition in Yemen. Also,
Saddam, can you just briefly mention the Iranian role? Because you mentioned a lot of countries, but you did not mention Iran. And there is so much attention going to that. Can you just briefly speak about that?
Yes, Iran denied, first of all, Iran denied arming the Houthis, but U.S. military said they intercepted some arms shipments in the Red Sea, which was coming from Iran to Houthis in Yemen. And they did that, like it's not only one time, 3 times they capture all these weapons coming from Iran. And so Iranians officials also suggested that they may send military advisors to support the Houthis. Lately in this month, Iran has sent its ambassador to Yemen, and he arrived to Sana'a in a smuggling way. No one of us knows how he entered Yemen and how he arrived to Sana'a, while all ports and airports of Yemen is under the supervision of Saudi-led coalition. So also Iran is playing a big role in the Yemen war by supporting Houthis. You can say supporting them by advisors, military weapons, and also intelligence.
Yeah, Saddam, thank you so much for that overview. It's really complicated and it's hard to give like a summary of the conflict of about 6 or 7 years now in just 3 minutes. But thank you so much. And from our work, from human rights organization work, from Human Rights Watch, from Amnesty, others, we have seen like a repeated disregard of civilians, of protection of civilians. And the main violation, I think, happening is the use of starvation as a weapon of war, and the humanitarian crisis, as the UN describes, is the world's largest humanitarian crisis. And for that reason, I think I should go to Majid. From your important work, how do you describe COVID-19 pandemic adding to what the warring parties, complete disregard and respect of international human rights laws and etc. But how the pandemic really affected the already dire humanitarian situation?
Thank you, Afra, for the organizing this meeting and this session. From us as humanitarian actors in the field, we found out that there is many issues. Is like giving a clear point can be highlighted about about COVID-19 impact on in the situation in Yemen. As you know, the majority of Yemenis people are depending on daily business or in daily income. So with the quarantines, with the mitigation measures has been taken in the country, how much is affect their situation individually and at the community level. The other issue also, Yemen is their education modalities is classic one. So even when they have to suspend the education process some months ago because the COVID-19, then there is no way like the other countries can be reach the students and can support how to find another modalities to learn. If we are talking also about the medical sector or the health sector as well, Yemen was been in blockade since 2015, and we have too much. We are lacking the medical suppliers and medical medicines and medical supplies. So you can imagine how much also COVID-19 needs and how much it's the shortage in the country. If you can also come back to the reports coming from the humanitarian actors working here, and also the announcement from the official channels as well, you find that 51% of the health facilities are fully functioning in the country. And you can imagine 49 health facilities is not functioning either totally or partially. So you can find also that how much COVID-19 is worsening the situation. The other issue also, if you look for the standard based on WHO definition about the benchmark of the health workers for how many people, it's 41 supposed to be for 10,000 people, but unfortunately in Yemen you have only 10 is estimated, is not even real number, is estimated 10 health personnel are for 10,000 people. You can imagine how much is also affecting the situation. Also, when we found the colleagues are fighting COVID-19, how many people has been died from those people who were fighting against COVID-19 in the front lines in the hospitals and the health facilities. I guess we are also the worst people has been suffered from that situation. So this what I try also to summarize the landmarks that can reflect really how much is also affecting the country and the situation.
Do you have any statistics about how many people were affected by COVID? How many civilians? The reported cases?
Not in the moment, but it's published in the media as well. But also, what they are saying that the reporting is not reflecting the reality in both in South and in North.
Yeah, I think that's very true because the numbers say something, and it's very, very difficult to collect data on the ground, even though you are in Sana'a and you're saying this. So the numbers don't really reflect the grim situation on the ground, and testing capacity has been extremely limited. You just mentioned the healthcare system is functioning by half. So for that, actually, it's a great turning point to going to Dr. Sami. Dr. Sami, I've had the pleasure of working with you, interviewing you, and one of the things that it still rings in my head from one of the interview I did with you a while ago is that basic things are very difficult to find in Sana'a. Like even vitamins are becoming rare commodity in Yemen. So let alone of medicines and the most vulnerable patient, they maybe cannot even afford getting expensive, growingly getting expensive medicine. So what's your priorities right now, like on a daily basis, when you go to the clinic, to the hospital, when you meet people? How do you prioritize the advices that you give? Like which? Yeah.
Okay. Hello, everyone, panelists and audience. It's very nice to be here. I would like to talk about my field as a doctor. So I'm from medical perspective. I would like to categorize my answer into several points, which I will talk about just briefly. So I will try to highlight the impact of COVID on the following. First, number one, the hospitals and medical facilities. Number two, the health providers. Number three, the medical resources and supplements. And number four, the availability of medical services as indicated by, for example, the numbers of beds. When we're starting with the first point, I should mention here that many medical facilities were already turned down when the pandemic arrived. The conflict left us with few hospitals, so we had to exploit some school buildings, which was not perfectly prepared as to become a hospital. Then when it comes to the health workers, the pandemic had made it harder for them to pursue their medical careers as expected. We are talking about many workers who refuse to stand on the front lines because of the scarce of personal protective equipment we don't have. And on the other side, the pandemic, unfortunately, and breakingly, and left us missing out heads of departments, emergency doctors, also the nurses with the infection. Moreover, mentioning the medical resources and supplements, I should point out that it was already disastrous long before the pandemic. The conflict, has put many barriers between the public and the required medical supplements. The conflict has been preventing the access of many grants and international emergency aids. There are patients today dying due to the lack of their medications, not just the COVID patients, but also those who suffer of chronic disease with regular medics. They don't. We cannot find the medications. Our heart failure use digoxin to treat their heart failure. So we can't find these drugs at these days. Patients, I know them, by myself. I know just 5 to 6 patients die. They can't find these drugs in the stores. Also, many of patients can't rule out to use their medications. Finally, public hospitals in Yemen have been insufficient since a very long time. COVID-19 aggravated the crowdedness and insufficiency of the public hospitals. And sadly, the private ones weren't a suitable substitutions due to the high cost. So we weren't confronted with people deteriorating within their house, lacking the needed medical help. We go to their house to give them the medical. So this particular point is what drove me to start my initiative. Stop Me If You Want a Medical Consultant. I had to transfer some partitions of the hospital's role into the street to reach those who couldn't reach us. And those who couldn't reach us is they are very very poor, and they can't pay for drugs, they can't pay for lab investigations, they can't pay for eat. So to conclude everything, we are left with medical community missing out important figures, supplements, shortcomings, crowdedness of hospitals, and basically torn medical buildings. I think we will talk about the poverty at the next questions to make a discuss with others.
Thank you so much, Dr. Sami, for that overview. And I must say, one of the most troubling situation for civilians in Yemen regarding the pandemic is the situation in detention centers, So it becomes it goes without saying the detention condition have been extremely awful for a lot of prisoners. And from our work in Human Rights Watch, some of the interviews and accounts that we had from relatives of detainees are just shocking. Many of the detainees in many parts of Yemen lack the proper medical attention and medical care that they deserve under the pandemic. So it goes without saying also for civilians, it's such a very difficult situation. But one of the troubling issue, Sami, I want to follow up on some of the things that you mentioned. Regardless of the terrible situation for healthcare facilities, but there is also a stigma وصمة عار يعني. Stigma among the community. Even Saddam, maybe I hope you can hear us, Saddam. Now, thumbs up if you, yes, okay. So even in Marib, some of the IDPs have been subjected to or were at high risk of COVID-19. So if we can talk a little bit about the stigma among the community themselves in Yemen. People tend to hide if they were exposed to COVID-19. Dr. Sami, can you speak a little bit about that? Because that also impacted the lack of, like, the difficulty in the data collection that we were talking with Majid earlier. People are hiding themselves and trying to report. So can you just mention, speak a little bit about that? Dr. Sami, and then Saddam also.
Okay, we'll start with me or with Saddam?
Dr. Sami first. Go ahead.
Okay. I'm trying to point out the huge lack of reports here and the missing of counts of morbidity and mortality rates. So we need numbers to stand on during raising the awareness of the disease. I meet people today telling me, and I quote, there is nothing as corona. It's a global fraud, or it's just a flu. The health educational system today is missing many ground knowledge due to the lack of the serial surveillance system. I think Saddam, if you can even put in.
Saddam, also, I'm glad you're back. I hope the audio is better. So yeah, Saddam, can you speak about a little bit about the impact of stigma also and the reporting about COVID-19 cases?
Yes. Yes, talking about the stigma and how people deal and treat themselves and others who are maybe, faced or got a positive result of COVID-19. Most of the people I noticed in my community, and even with the people who are at the IDPs camps, they didn't realize the danger, and also they didn't have that awareness of COVID-19.
Is it about the awareness or the seriousness?
No, they didn't take it seriously. Even some organization, they did a lot of efforts in raising awareness among different peoples, especially at the IDPs camps. And they just didn't take it seriously, and they didn't, deal with the face masks and hand sanitations and everything, all these things that prevent COVID-19. They deal with it like, why you are wearing a face mask? Nothing will happen. Yeah. God is protecting us. We are facing a lot of difficulties, a lot of problems in Yemen, bigger than COVID-19. Go to the hell, you and COVID-19. So yeah, so people, they didn't take it seriously, to be honest. Due to a lot of, crisis Yemenis has been through. We have been through cholera, we have been through fever, dengue, and so it doesn't matter with COVID-19.
It's just such a unfortunately, it's just sad to hear that because a lot of things are intertwined here. The economy is also having great impact in the level of literacy among the communities. But Majid, you wanted to add one point on that, and unfortunately, you're an international organization, and we need to hear from you. What are you doing to raise awareness? There is a lot of this kind of talk towards international organizations in Yemen. We're also like asked as Human Rights Watch, what are you doing? So what your organization is doing to raise awareness among the community about the seriousness of the pandemic, and also I'm keen to hear what point you want to add. Go ahead.
Okay, thank you, Afra, and thank you, Dr. Sami and Saddam. It's not only related to stigma, as you just mentioned, and with the guys. It's also misinformation and rumors has been spread out in the country, especially about how the health system is collapsed, and how the experience of the medical team and also some health facilities are not treating well the patients. So instead to get better, they are dying in the health facilities. So kind of rumors, and especially this misinformation spread out through the social media is worsening the situation, and also create confusion between the people in Yemen community. And you can find even some relatives, as Dr. Sami said, that some people, they don't believe yet there is COVID-19 in the country. And also some people, they are saying that just they are overestimated the disease. And some people also, there is many issues. It's not only related to stigma. It's also the main point for me is that is malinformation or more misconcept about the disease. It's also should be to treat that. It's should be a media trying to address this issue. I saw some media was talking about the misinformation and should avoid it because it creates confusion. Then you are not treating well at both levels, at the health facilities levels and also at the house level. This is in terms of the first question. So as the second question, sorry, Saddam, you can go ahead, please.
Sorry. I would like just to add something. You know, the stigma among the medical community. You can't imagine doctors were accused of taking people lives with Rahma injection. You heard about Rahma injection?
Yes.
As they call it. Doctors were attacked and hospitals. This one of the biggest stigma that you can't imagine how many people talk to us about this injection. We don't know about this injection. So this one to be mentioned to your misinformation that you mentioned about.
I got it. Okay. I think Majid just mentioned really important thing regarding the misinformation. And I think it's very important here to say, since the largest portion of the population in Yemen, the nearly 30 million people, a big portion of them live in areas under the control of the Houthi armed group. And the Houthi leadership have made it clear from the beginning not to report truthfully about the impact of COVID-19 in areas under their control. And actually, in one of the interviews, one of their key leader, Mohammed al-Houthi, went on BBC interview and mentioned that we don't want to terrorize people, so this is why we're hiding the information. And that by itself, it's really harming civilians, not getting truthful information about the impact, really it led to the stigma and misinformation and all that kind of complication. I think it's worth mentioning this. But let me just, my colleagues are giving me a note that I should encourage our audience and viewers through the YouTube and this platform, Hopin, also. Please send in any questions, any thoughts you have. We have Sami and Majid in Sana'a doing important work over the past, like 6 years under this terrible, unnecessary war impacting all aspects of life. We have Saddam and Marib doing important work on documenting HR human rights violations and great reporting on accountability issues. So do send questions if you have. So I want also to get back to Majid. You have so many things to advocate for in your organization. I can imagine your advocacy work is just endless. So what do you think is the key, after all what we described, what do you think is the priority for a humanitarian organization like yours to advocate for?
Well, for the moment, I can mention also, we should not forget the other priority in the country, especially in the health sector and the other also sectors. I can mention here the other outbreaks like cholera. What about cholera? We should not forget about it as well. It's also a disease who can it can kill a lot of people as well. Also diphtheria. As far I know, diphtheria is like the last reported cases was about some years ago, about 30 years or more in the worldwide. Then recently is appeared some cases in Bangladesh, then in Yemen. So this also is a disease we should not also forget. The other situation as well is the Humanitarian Aid Fund, because we know the worldwide has been suffered from COVID-19, and each country they have their own priority. But also in Yemen, because we have multiple layer crisis in Yemen, so it's worsening the situation more than the other countries. So Humanitarian Aid Fund, it's one of the priority we should address. With COVID-19, you have see how much you are lacking the sources, and now the Humanitarian Fund is starting to cut slowly or from time to the other. The other also, like we saw some malnutrition program in the country. It has been also not generated because the lack of fund. So many priorities, but for the moment, I could focus about this situation. One also is general priority is not only for us, I think for all Yemeni people, for all humanitarian actors, it's stopping the war. Is the first step, should be, it's one of the points we should advocate for. Thank you.
Saddam, do you have any thoughts about some of the points that Majid just mentioned?
Yes, I agree with what he said, and I have a comment related to humanitarian funds and money. I have been involved with and reading a lot of reports and also monitoring many projects that has been implemented by international organizations and also local organizations in Yemen. I have noticed that most of the humanitarian funds that goes for Yemen, billions of dollars has been raised during the last 5 years, and there is no impact on the ground. When you see each project or each organization is doing or implement projects in Yemen targeting IDPs or helping or in the health facilities or related to COVID-19, you will see that 80% of their budget is for salaries and operational cost, while only 20% of the project budget is for the real activities. And this is the problem. I want to also share my inputs or one of the recommendations that I would like to share with you and other viewers, that we need the international community, international NGOs to shift from humanitarian response into development, into doing projects that is help people and build their capacity.
So Saddam, even if the war did not end today, you want to shift the focus to development? Why?
Yes, because 5 years or almost 6 years have passed away, and people, and I mean IDPs and Yemeni people affected by the war still depending on the humanitarian response, for example, food baskets and etc. And that is will create a community and a generation that depend on others, and we don't need to face a problem in the future. Having such community didn't have equipped with the market skills, and we don't want a community where they don't involve and participates actively in building their country. We need organizations to focus on development and also to implement projects focused on capacity building of people, entrepreneurship, and also in projects that help the community. Talking about COVID-19 and billions of dollars for COVID-19, we just see like awareness campaigns, distributing of face masks and hygiene kits. That's it. We didn't see a real work. For example, building a health facility in a remote area, or paying salaries for medical workers who are without salaries since 5 years. That is the real interventions we want from international organizations, rather than distributing only face masks and hygiene kits.
So Saddam, great points. So one of the questions that we had actually speaks or asked about is there any misuse of relief funds by the government in Yemen? Does the government prioritize humanitarian aid? And I guess, I suppose the government is the internationally recognized. It's meant with the government, the internationally recognized. So are you saying all these recommendations because you see a misuse of the relief funds?
Not only, I will not say a misuse. There are, projects and people working in the ground to help those affected by the conflict. I will not say, I'm not saying that or watching that or notice that in my daily life, but we need like sustainable activities, sustainable projects. Instead of giving me a food basket every month, you need to learn me some tasks, some skills, provide me with the startup machine, etc. And then you say, go ahead, Saddam, earn money, get you a monthly income by your hand. So they need to do like trainings for IDPs and those people affected by the conflict. And they need to provide them with the equipment they need, the skills they need, so they can, after 2 years, they they are depending on themselves and no need for humanitarian response anymore.
I understand you. You need a rethinking of how the money, the aid, the international aid is going to Yemen, with a new vision and a new strategy. Yes. So one of the questions actually we have from our audience, and this question goes to Majid. Is there a system of coordination between the humanitarian organization for humanitarian intervention for Yemen? Are you working through a coalition? Is there coordination with the different humanitarian partners? How do you how's the process?
Yeah.
You're muted, so I think you should unmute. I just unmuted. Go ahead, Majid.
Yes, there is a coordination is between. I can talk about the health sector and also the other sectors, but I will focus about the health sector because there is a health cluster is also gathered all the health actors in the country. They are also arranging, and there is kind of coordination between themselves. They are dividing also the tasks among themselves. We cannot say that it's 100% done in the country, but yes, there is a coordination system. I can say also WHO is the one leading the coordination cluster for the health. UNICEF is leading the nutrition cluster, and also there is another NGOs leading the WASH, other NGOs also leading the protection system.
And do you think this is the right way of doing so?
Sorry?
Or do you have any recommendation for how the coordination should? Is it going well, or do you have other recommendation from?
Yeah, there is no 100% perfect work, especially in a country suffered from different crises. So we can say this. Yes, the coordination is taking the way. We can say it's good in good way, and also daily dialogue and daily discussion is going on between the NGOs and also with the health authorities. Is matter for me is matter of coordination in daily basis, and also is a normal work challenging. So it's a challenge, but it's also it's in a good way moving. I can recommend that, yes, should be, how we can say, put a concrete lines where the NGOs can go through, can also coordinate even at the individual situations. I can tell you, for example, we are supporting a certain health facility, where is also it's supported in a different department inside the health facility from UNICEF. You find also they know what they should do, and we are complete the other part, or vice versa. You find the other NGO is supporting in a part, MDM is supporting in the other part.
Dr. Sami, you heard some of the points by Majid, Saddam. Saddam mentioned the recommendations, and it's great to hear about the teamwork among the humanitarian actors. But from your work, are you meeting representatives from international organizations? Do you have collaboration with them? What kind of recommendation you would have if you're not pleased with the ongoing style of work?
Yeah, I agree with Saddam regarding the development. But I just want to mention that don't give me a fish, just teach me how can I fish. So and also the organizations in Yemen should start refilling the gaps left by the pandemic, replenishing the scarce resources and rebuilding the medical community by, for instance, commencing training programs, also medical emergency courses and health educational lectures with a strong mass awareness raising programs. Because many public health specialists realize that education is one of the primary preventive measures. So it should be the first approach to adopt in order to revive the health status in Yemen.
So unfortunately, we lost Saddam. Too bad. I hope he can make it. But okay, since today our focus is really the humanitarian crisis, even though there has to be a political will to end the suffering of millions and millions of civilians, but meanwhile, until there is that political will, Majid, what do you think is? I mean, you mentioned ending the war. It has, that's a demand. But until then, what is the most crucial message that you have for our audience? What if you have like a key message that you want to say to the international audience? What that would be? Is it more support? Do you want like stop arms sales to Yemen? What kind of one message, like the toppest message you would want to share?
I could say here as humanitarian actor in the country is, as you said, beginning is stopping the war. We should put our feet in the first step in the right path. Then we start to move to the second part, is the recovery of the country, starting as Saddam said, the development, sustainable systems is starting from that way. But you cannot move to that stage while you are in the stage before ending the war. The other situation we can I can address it here is also break the country blockade. It's really affecting the country, and I don't think so is solving anything. So there is many issues where you can state you can start break crisis one by one to solve the situation, but you never start. For example, you never start with the fuel crisis while you are not start with stopping the war. You cannot start with the other. You cannot start with talking about the filling the gap of COVID impact, as Saddam said. We have not started to break the blockade on the country. So you need is a step should be start from, then you can talk about the other one.
Unfortunately, as the conflict rages on, things are just getting more and more complicated, and a lot of things are intertwined. It's the fuel crisis alone needs another webinar, I think, because it's just impacting every aspect of life, especially like the healthcare system, the educational system, people mobility, ability also. But Sami, since we're also like time is running up, so we have about 5 minutes. But do you have any last message, the most top message that you want to say to our international audience? I mean, it's, the blockade, for example, it doesn't make sense anymore. And the more parties to the conflict, or the more emerging new parties to the conflict come, the more they are controlling of entries in Yemen with checkpoints. So it's not only the Saudi-led coalition blockade on Sana'a airport, but across the country, even just going with bus, with cars, it's just becoming extremely difficult. So even like internal blockade is happening as well. So Sami, any point that you want to raise at the end?
Yeah, as what Majid mentioned, we should reframe the current view on each and every level. So the war crisis, the economic crisis, the mass impoverishment, the educational system, the health status, and the political body, these all must be recreated from the scratch. I would like to focus here on something. I read recently saying that the Yemen International Pledging Conference failed to fill the huge funding gaps that will help us to address COVID-19 and others throughout the country. Funding dropped by 65% compared with the last year. So it's very essential to refuel the funding resources in order to move forward. It's of course not an easy mission. It needs years to be fulfilled, but it should start urgently. The change should begin at this point in order to find the desired results. There is many talks about Yemen. The 1 hour can't be enough to say all things, but we want the world know what we suffering here in Yemen. The situation is very bad. We are suffering from everything. People here dies even not just from the disease, from the war, from the killing, the hunger, many things here in Yemen. We want the world to know about it.
It's a tortured land, as the latest report by the UN experts describing Yemen. It's not forgotten conflict anymore, but it's just a tortured land with all warring parties really making life hell for civilians on the ground. So we had Saddam for a second and he left. Unfortunately, we cannot get his last comment. But I'm really grateful that you were all able to join us, continue your important work. From me, I'm just reading what Saddam is writing. Unfortunately, Saddam is having some technical issues. We apologize for that, but that's what we can get with the internet connection in Yemen, unfortunately. So yeah, thank you so much, Majid. I'm nice to meet you, Dr. Sami. Thank you so much for all your inputs.
I'm very glad I was that I am part of this conference. Thank you very much, Afrah and Majid. And nice to meet you, Majid. I want to know you here in Yemen.
You're in Sana'a. You should. I'm happy to exchange the numbers.
Yeah.
Maybe if he's chewing cut, I didn't.
Oh, okay. Saddam, can you add a last comment via the chat inbox, if you can? We're not getting any reply from Saddam. But anyway, thank you so much, and we just hope Yemen is not forgotten anymore, and it's not with the great work that you do. So keep up the hard work. Yeah, and thank you so much for our audience watching us live. And yeah, that's it for today.